Well, welcome everyone. I am Lauri DeRuiter-Willems, and we're happy to have you all here today. This chat is fun to see you joining from all over the country and looks like some other countries as well. Jennifer, are you ready?
Yes, I am.
Okay, I'm going to minimize the chat and here we go. So as I said a second ago, I am Lauri DeRuiter-Willems. I am an assistant professor at Eastern Illinois University in the Department of Public Health. And I'm joined today by with Jennifer Cannon. You want to share?
Hi, yes, I am Jennifer Cannon. I am an instructor in the Department of Public Health at Eastern Illinois University. So on this slide, we have our agenda. We are going to talk about why we started this, talk about the activity, go into our findings, and also get some reactions from all of you. But prior to going into our information, we want to know who we have in the audience. So there is a poll that is soon to appear, and please fill this out. We want to know what category best describes your affiliation or who you are representing today. We also want to know what part of the country you are from, whether it's the West Coast, Northwest, Northern Midwest. We want to know who we have here today. So please take a moment and click on the poll that should appear on your screen. Okay, we'll take a few more minutes to see who we have in here. And if you don't see one that best represents where you are from or your category, please select the closest one.
Looks like we're pretty close. Should we move on?
Yes. So it's always good to know who we have in the audience, just to sort of break the ice. It looks like we have everyone from all sectors around and from everywhere. So thank you for participating in that, as we just wanted to break the ice a bit. So now let's go into our objectives for this session. So from this session, we would like for individuals to understand the role of the social determinants of health and privilege, and also look at the lack thereof and how it relates to health literacy. We also want to ensure that individuals are able to integrate the modified privilege activity into their own work. We also want to ensure that individuals will be able to facilitate a session, including the modified privilege activity. As we complete this session, you will actually go through this activity. So we ask that you have a pen and a paper readily available. So we will give you a moment to grab that as we continue to go through the privilege walk.
So because we're all here, we clearly have an interest in health literacy. And after several years of teaching concepts about health literacy to undergraduate public health students, I began to realize and feel like we were missing an important step. So social determinants of health. If the students weren't making solid connections to either their own lives or the community or specific populations, the health literacy concepts still felt very abstract. And secondly, I was finding that when I was applying the ideas of health literacy concepts to real life situations or even practice situations in a classroom, sometimes they weren't very realistic. We know it doesn't work just to say, do this and just go out and do it. And we're talking about health behavior changes. We needed to dig deeper into the barriers and the hurdles that prevented individuals from engaging in positive health behaviors and making those positive health behavior changes. So these barriers could oftentimes fit into any of the social determinants of health. So we're going to do another poll. George, can you help me get to the next one? Never mind, I found it. Okay, here we go. If you guys could take this, all of you could give us a yes or no answer there. Okay, looks like we've got a good representation here, and looks like more people have not participated in one of these traditional privilege walks, more not than have. So I'm going to end this, and there you guys can see it now. So we started this version of a privilege walk for several reasons. First, some of the statements can be reminders of some less than pleasant parts of our lives, our history, and our past. It can also be very intimidating and emotional at the end of the activity to be at the back of the group or the front of the group. Our history doesn't always reflect our success. One person might have plenty of privilege, but has not accomplished much in terms of education, career, life, and the opposite could be true too. One who's had to overcome many barriers or being seen without much privilege can be very successful in any parts of their lives. Next, on a practical level, the course I use this activity in most is sometimes taught 100% online asynchronously. Therefore, I'm not in the classroom and I'm not even on a screen at the same time as all of my students. So both of these were factors that led to this idea of trying this version of a privilege activity. If we do it in person, we can have the students all have the same length of string and tie knots in it, or just keep tally marks on a piece of paper to reflect the statements that reflect their history. This saves any embarrassment and uncomfortable feelings that others might have recognized when they were all standing in a line together and some are moving forward and some are moving back. So this activity can easily be converted to an online synchronous activity by asking the students just to keep a tally of their statements, or even it could be done asynchronously and just having them record the number of yeses and nos, and then engaging in some online activity in that way. So it really is just a reflection of our history, not anything to do more with our success. So after exploring many versions of the privilege walk, we came up with these 40 questions, most of which can be matched with one of the social determinants of health. So let's try it, and then we'll discuss afterwards and debrief how we debrief with our students, and then we'll have a chance for you all to ask some questions as well.
So let's go over some of the instructions and as well as the purpose of it. We firmly believe in letting people know the why of the matter. And the purpose of this activity is to explore the intersect of privileges and marginalized groups in a less confrontational and more of a relaxed way, and to connect these to the social determinants of health. So as we bridge into this activity, again, please take out a piece of paper Write yes or no with space by each word for you to tally. So you're going to have a piece of paper and you're going to write yes or no as I read the statements. Now, listen to the statements that I read. Think about the statements in terms of your own life and answer yes or no. Yes means that you have experienced it or it applies to you. No means you have not experienced it or it does not apply to you. We ask you keep your answers to yourself. We will talk about the statements and the connections to the social determinants of health at the end. So, are you all ready? We are about to go into the statements. Please have your paper and pen ready. The first statement, you are right-handed. I will read each statement twice. You are right-handed. Your ancestors were forced to come to the US not by choice. Your ancestors were forced to come to the US not by choice. Your primary ethnic identity is American. Your primary ethnic identity is American. Your family owned the house where you grew up. Your family owned the house where you grew up. You saw members of your race, ethnic group, gender, or sexual orientation well represented in a range of roles on television and the media. You saw members of your race, ethnic group, gender, or sexual orientation well represented in a range of roles on television and media. You have ever been offered a good job because of your connection to a friend or family member. You have ever been offered a good job because of your connection to a family friend. You were inherited or are likely to inherit money or property. You were inherited or are likely to inherit money or property. You have had to skip a meal or go hungry because there was not enough money to buy food when you were growing up. You had to skip a meal or go hungry because there was not enough food to buy when you were growing up. When you or a family member were sick, your parent or guardian could stay home with you. When you or your family member was sick, your parent or guardian could stay home with you. One of your parents was unemployed or laid off, not by choice. One of your parents was unemployed or laid off, not by choice. You attended private school, summer camp, or took family vacations growing up. You attended private school, summer camp, or took family vacations growing up. You have ever been homeless or a family member ever had to move in with you because you could not afford the rent. You've ever been homeless or a family member to move in because you could not afford your rent. Your health providers were the same race as you. Your health providers were the same race as you. You have ever been stopped or questioned by the police or followed in a store or were accused of cheating or lying because of your race, ethnicity, gender, or sexual orientation. You have ever been stopped or questioned by the police or followed in the store or were accused of cheating or lying because of your race, ethnicity, gender, or sexual orientation. Your family had an established pediatrician or family doctor. Your family had an established pediatrician or family doctor. You grew up in a household with hired help. You grew up in a household with hired help. One or both of your parents are educated professionals and have a college degree. One or both of your parents are educated professionals and have a college degree. You were raised in an area where there was illicit activity like prostitution, drug, and or gang activity. You were raised in an area where there was illicit activity like prostitution, drug, and or gang activity. You can show affection for your romantic partner in public without fear of ridicule or violence. You can show affection for your romantic partner in public without fear or ridicule or violence. Your family used the emergency department or convenient care services instead of a regular medical provider. Your family used the emergency department or convenient care services instead of a regular medical provider. You started school speaking a language other than the primary language. You started school speaking a language other than a primary language. As a boy, you could play with dolls, or as a girl, you could play with trucks without anyone questioning your choice. As a boy, you could play with dolls, or as a girl, you could play with trucks without anyone questioning your choice. You were taught about American history or about contributions made, you saw, and heard stories about people who look like you. You were taught about American history or about contributions made, you saw, and heard stories about people who look like you. You can walk after dark in public places without fear. You can walk after dark in public places without fear. You have ever felt uncomfortable by a joke related to your race, ethnicity, gender, or sexual orientation, but felt unsafe to confront the situation? You've ever felt uncomfortable by a joke related to your race, ethnicity, gender, or sexual orientation, but felt unsafe to confront the situation? You were told that you were beautiful, smart, and capable by your parents. You were told that you were beautiful, smart, and capable by your parents. You have ever been called names because of your race, class, ethnicity, gender, or sexual orientation. You have ever been called names because of your race, class, ethnicity, gender, or sexual orientation. You rely or have relied primarily on public transportation. You rely or have relied primarily on public transportation. You were ever discouraged from academics or job because of race, class, ethnicity, gender, or sexual orientation. You were ever discouraged from academics or jobs because race, class, ethnicity, gender, or sexual orientation. You have been the victim of violence related to your race, ethnicity, gender, or sexual orientation. You have ever been the victim of violence related to race, ethnicity, gender, or sexual orientation. Your parents did not grow up in the United States. Your parents did not grow up in the United States. The majority of the staff at your elementary or high school looked like you. The majority of the staff at your elementary or high school looked like you. Your school had plenty of books in the library, computers for students, and additional resources for students and teachers. Your school had plenty of books in the library, computers for students, and additional resources for students and teachers. You have not been teased because of your last name. You have not been teased because of your last name. You and your family had regular dental checkups or dental care. You and your family had regular dental checkups or dental care. When a question about your race is asked, you are not the only one singled out to answer or speak your opinion. When a question about your race is asked, you are not the only one singled out to answer or speak your opinion. Using public bathrooms and going up and down the stairs in public spaces are easy for you. Using public bathrooms and going up and down the stairs in public spaces are easy for you. You and your family had health insurance, not Medicare or Medicaid. Your family had health insurance, not Medicare or Medicaid. Your intelligence is not questioned because of the way you speak. Your intelligence is not questioned because of the way you speak. Your parents told you that you can do anything you wanted to do and encouraged you in every subject and encouraged you to attend college. Your parents told you that you could do anything you want to do, encouraged you in every subject, and encouraged you to attend college. Now, please take a moment to add up all your yeses. Okay, as you add those up, and for the sake of time, please answer the poll questions. We'll be sure to save some time at the end to explore more reactions to the activity. So again, please look at the poll questions. Again, we may have time at the end to talk about some of those reactions, but for now we are focusing on the poll questions. Okay, let's go into our findings. So,
A couple more seconds to let some people, looks like they're
okay,
adding in.
okay.
All right, let's go ahead and move on.
Okay. So we conducted this activity in several courses over the past year. We conducted this online as well as in person. And in hopes and efforts to maintain confidentiality, we asked students to complete an online survey after finishing the activity. After letting them know about the survey, we invited them to discuss the connections of the social determinants of health after the activity, and also provide an outlet for students to express their general feelings, perceptions, and opinions as well. But we asked them not to share personal stories. Now, this doesn't happen always, but we knew upfront that it was not a requirement. So these demographics match our typical response at our institution.
Here's a little bit more of a breakdown of what our demographics were from our students. And again, this is a typical pattern from what we see at our university. Now, this is a little more interesting. It shows the frequency of points based on the yes and no responses. So while there is a wide range of scores, the highest range was 48% who scored or reported that they agreed with 21 to 30 questions. The low end of the scale, the lowest 25%, was reported by 16%. 11 to 20 questions of agreeing with reported at 26%, and only 10% said yes to 31 to 40 questions. So our estimation is that about 26 of the statements showed that one had more privilege, and 14 of the statements showed that one would have less privilege. This may be determined differently by others, but that's what we found, and we'll share a little bit more detail on our findings in the next few slides. So whether or not one may have have an inheritance was a little more difficult to answer for some people if they weren't familiar with their family tree or their history further back than their grandparents. Um, and on the right side, while most reported not having any disability, those who reported invisible disabilities was almost twice from the visible ones. And it was really nice to see that most said the activity helped them better understand the social determinants of health, and that the uncomfortable or hurt feelings were much less than the comfortable feelings.
So we wanted to, again, find the reactions from the students. So we asked questions such as, what went through your mind as you heard the questions and you answered them? Which of the privileges did you inherit from your family? Also looking at how this exercise made them think differently about their own identities. Some of the responses that we got was, we had students report that it opened their eyes to some things that other people experienced in their lives. Students also reported they became aware of things that they take for granted. They stated that this survey was a good reminder of how lucky they are. We also had students report that hearing these statements together helped create a broad picture of how many factors there are that relates to health, as well as the social determinants of health. Students also reported that it made them think about blind spots, places where others experienced discrimination that had never occurred to them. We also found responses that say, after a few questions, students thought that here we go again. But as they went through the activity, they found that they realized how blessed they were. On the next slide, we also talk about more responses that we gathered from students. Students reported that at some parts, again, they realized how blessed they were and some of the privileges that they had that they were not aware of. Students reported more saying that they're privileged in many ways that they had not thought about. So many people say that this was very eye-opening from them. Students also related this to their future careers, how they are going to take this information to develop themselves and get in touch with their identity as well. Whereas we also have more reactions on the next slide. Again, the overall consensus of students becoming more aware. But we also related to, how does this connect to the social determinants of health and health literacy?
So in our classes, we go through each of the determinants and discuss which statements the students feel match and why. These conversations are very free-flowing and often lead to revisiting concepts in our introduction to community and public health course. It offers an opportunity to make connections to our basic concepts and reminds us students that our field of public health is very interconnected with other disciplines. Most of the statements could be matched to a few determinants, while few, if any, can be matched to only one determinant. So we're going to take another poll here. I believe this is the last one. Yes, here we go. Go ahead and take maybe a minute and a half to answer these. We'll give you about 10 more seconds to finish up. Okay. So when we asked the poll question, which determinants you felt most represent, you feel most were most represented, um, economic stability and community and social context. That's probably about right. And those connect with many of the others, but those would be obvious ones. The second question here, which determinant did you understand the least? Looks like we've got a pretty fair spread here. Healthcare system, community and social context, looks like they were the highest reported ones. Our students regularly report that community and social context is the most abstract to them. So, excuse me for a moment. So moving on here, I'm sure we've all read these definitions at some point, but when we use this with our students, we do introduce both of these definitions for personal health literacy and organizational health literacy. We also revisit these in other classes so that students feel that that's important, and we think it's important for them to understand both from a personal point of view as well as the organizational one. And these are from the Healthy People 2030 definitions. What we really like about these updated definitions is that not only do they suggest that an individual be able to find and understand information, but they're actually using the information, or that they're able to use and engage with the different components. So we think that's a very important part of these new definitions. So then the next part, this slide is really where we make that strong connection between the social determinants and health literacy. After the students complete the 40 question or 40 statement activity, we discuss which questions reflect which determinants, kind of like you just did in the poll. We then can further explore them in terms of what they mean, what the barriers are to finding, understanding, and using information. We know some of the characteristics of individuals with lower health literacy, elderly, less educated, lower income, non-native speaking American or English, and compromised health system or status. So let's briefly explore some of the factors and how we can break these down and look for solutions. When we look at education and language, the barriers can often be connected to numeracy as well as basic literacy. Some of these solutions, and we've heard plenty of these earlier today and yesterday, and I know we will continue throughout the conference, that plain language practices are very important. Using images as tools to represent numbers and proper interpretation to other languages. And as we have our, ASL language interpreters here today, that's also, a form of this interpretation, all of which are very important. So when we look at the next part about access, money is the obvious one. And what we need to consider here is if the individuals have the financial resources to spend on expenses to improve their health conditions. And time is a little bit more abstract. As health educators, practitioners, and providers, it may be one more difficult, because we know it's important, but all types of time commitments need to be considered. Work, family obligations, transportation time, they all go into the ability of one to engage in those better health practices. Location is another thing that's really important, and it's connected to transportation. How far away are the services that one needs? We know it's easier to make a commitment if you can just jump in your car and drive to the location, or if there's nearby public transportation and you can get to a facility in a few minutes, or if it's more difficult because you need to wait for a ride, or you need to transfer buses or trains, or maybe you don't have that access and you have to walk longer distances. So when we talk social and community support, these are vitally important. Can an individual rearrange work and family obligations to attend clinical appointments or exercise rehabilitation appointments or attend behavior change sessions? And are others willing to step up or step in to help out? Will family and friends and colleagues, employers, will they be encouraging to encourage the individual to make those changes that are needed? So on this slide, we have a lot of pictures. We use these visual representations of each determinant on the left to show how they're interconnected and how they intersect. They are also each part of the role, play a role in inequity, inequality and quality, equity and justice, or even liberation, as the images on the right show. We recognize that the statements included in our activity may not touch on all of the determinants equally, and we hope to continue to improve the 40 statements to be more inclusive and more representative. So using this discrete privilege activity as the beginning of cultural competence training could help participants recognize some factors that might have an impact on their clients, patients, or students on learning about health or engaging in health practices and things like that. Jennifer, would you like to add on a little here?
Sure. In addition to the cultural competency piece, we also make sure that everyone understands and knows the terminology that's being used. Prior to implementing this in my course, I ensured that we talked about the social determinants of health, ensured that everyone was well aware of the terminology used, even on the survey instrument. So when we talk about putting this activity in practice, we have to make sure that we define words. We have to ensure that everyone has the knowledge to complete the activity. And thus, we know that that is going to help with the evaluation component, making sure that we are using everything that is clear and concise, and that we all are on one accord in terms of implementing this into practice. Well, as there are other ways to implement this activity. Again, we shared this activity with several courses across many different majors. So we went to nutrition and dietetic classes. We also went to sociology department, psychology, counseling, and many other student groups in the realm of nutrition and public health. Another form of this activity is the deck of cards activity. And this is where students are given a card from any card deck. And we have people around them treat them based on the number of their cards. So you would hand students a card, let's say they had a 3. They would place the 3 on their head, and those who could see the 3 would treat them as they would expect a 3 to be treated. And what we found was that individuals started to link together. We saw groups of the 3s, we saw the kings group together. And when we talked about this and had the open discussion, we allowed people to express how they related to the activity or how they did not relate to the activity. Again, providing individuals to have that open space to talk about it. So instead of reading the statements, we put it more into practice by utilizing the deck of cards as well. Lauri, would you like to talk about the, yes.
So we know that the social determinants of health and health literacy are connected to everyday lives. Here are just a few more examples. I love to golf, and my golf partner just recently retired as an executive with a national insurance company. She told me about educating their call center staff on social determinants of health and health literacy, and how that helped them with their calls with insurance clients. They were able to help the callers get the services they needed and understand and explain answers in terms that the caller would more easily understand. Another friend of mine is on the board of a local homeless shelter, and she shared that helping this shelter staff understand these concepts is important for helping them to offer more assistance to those that are using the shelter. So while the social determinants of health and health literacy can be used in medical and clinical interactions and in health education, health promotion, and health behavior change efforts, we also know that social determinants connect to other industries, disciplines, and organizations. It's kind of connects to Maslow's hierarchy. If our basic physiological and safety needs are met, individuals can then engage in the higher order activities to help them improve their overall lives. And we may ask in a second, we'll check the time here shortly. I think we have just a couple more slides, then we'll open it up to more questions and such. So we will share this link in the chat in just a second. Jennifer, do you think you can do that, or should I do it in a second?
I can do that. I'm not the host, so I'm having.
Okay, I can do that in a second. But anyway, this poll is, or this survey that we have the link for here, is very similar to what we, the results that we just shared with you, with the ones that we had our students do. And we would appreciate it if you would take a few minutes to complete the survey. It's your chance to share your other more thoughts and feelings confidentially. And in just a second, I will add that to the chat while Jennifer is doing the next slide.
So we say now it's your turn. So these are some of the typical discussion questions that we use with our students after we finish this activity. Again, focusing in on the why, getting that content, getting their statement. So we asked them, how did you feel answering the questions? We also asked, what was your initial reaction when hearing the first 5 questions? Was there one question that stuck out to you? Why do you think these questions were hard or easy to answer? Or how did this exercise make you feel differently about your own identities, daily experience, or relationships with other people? We also asked, which of these privileges did you inherit from your family? So these questions, again, we wanted to understand our students. We wanted to provide the connection between the social determinants of health as well as this information. But we also want to get your feedback as well. So I will ask 2 of these questions, and if anyone would like to answer, you can unmute your mic or place them in the chat. And the first question would be, how did you feel answering the questions? Again, you can answer in the chat or raise your hand, any other format that you feel comfortable with.
All right. Are we getting answers? Give me just one second.
While we get the answers, I will repeat the question, and it was, how did you feel answering the questions?
Okay, I'm saying non-threatening, reflective. Some of them are a little confusing because they can be answered one way or another.
I had never, oh, it just went away.
And there's a bunch of them on here.
Mm-hmm. Someone said, I never thought about some of the questions when I participated in the survey. Another question, was there one question that stuck out to you? Again, was there one question that stuck out to you?
right? I'm reading plenty, trying to read these responses. And some of these questions are a little confusing. If you could maybe answer them different ways, depending on, how you considered. A lot of it's looking at your background, like where, and we've had students say, well, I moved a lot, but then when I was settled in one location, then my answers would have changed. So sometimes that can be, and I think the idea of this is not that there's no specific right or wrong answer. And the questions kind of just are here to make you kind of think in general, how much privilege do you have or don't you have? So that's kind of why we decided that I think somebody just here wrote, there's safety and anonymity. I can share a personal example that one of the first times I did this privilege walk, I've had a pretty easy life, and I acknowledge that. I was moving forward, and there was someone towards the back of our group at the end, and this person was crying. And we had a great conversation because I said, I've had it pretty easy, but this person is the director of a major department at an organization. And I said, you have succeeded so much more than I believe that I have at that point. And I think it was a little reassuring. But at the same time, I felt uncomfortable because I know I was a little further in the front than the rest. And there wasn't any reason, much more because of who my family was and where I lived. So that's why we felt it was important to do this in a more confidential way. And I apologize. I'm going to have to stop the screen to get the survey link to share with you all. So I think I can do that now.
Okay,
I know
well,
we've got some Q&A going, and also things are popping up here in the chat. So I'm wondering if we can look at the Q&A questions
okay.
for a second. Let me try to get, I think I can just stop this.
So I can read off the Q&A questions while you do that.
Can you see them?
Yes.
Okay. Go ahead, Jennifer.
So one of them was open-ended questions. Okay, so one of the questions was, is there meaning associated with the number of yes and no responses?
Are you going to type the answer in, or should we just talk?
We can just talk. Did you want to answer that?
So I don't think there's an overall number. We picked 40 because it's it gave a larger opportunity to address many of the determinants, and it wasn't a really long time. I hope you guys felt that it wasn't a terribly long survey or activity to participate in. And of the 40 questions, as we said somewhere in the slides, 26, in our opinions, if you answered yes, reflected privilege, and 14 reflected less privilege. We may continue working on this, try to make it a more an even balance. But that's kind of, so nothing really specific, more of just bringing awareness to what may be considered privilege. Here's another one. We didn't ask about age or disability status. I think there was one on disability at the very end, but age certainly is one that maybe we should include. And that's a good point. Thank you.
One of the questions that I just came across is, it reads, I feel this is a great introduction activity to start some self-reflection or revisit self-reflection, depending on your background. Do you provide the students with next steps and the resources as future health professionals? So yes, we do. I implemented this activity in our community health class, in which we both teach. And we have a paper that also coincides with this, that also brings in the goals of that individual, goals and how it relates to themselves, the community, and society. So we provide more information as well as integrating it through the semester as these identities and the self-reflection comes about.
And a course that I've taught regularly and updated over the last probably 12, 15 years is we just renamed it to Introduction to Health Literacy. And after we discuss the social determinants, we spend a lot of time incorporating that into learning how to use health literacy concepts in written material, in spoken interactions, how to discuss teach back methods and teach me three, or give, tell me three different ways to find out if the individuals that are students who eventually will be working somewhere in the world of health will be interacting with people. So that is kind of how we connect this. Another question was about invisible disabilities. I guess those, I haven't looked at those a lot, honestly, but things that aren't very clear and noticeable. Like it might be a hearing, it might be a processing disorder or condition, things like that. I'm going to keep reading. Do we offer a trigger content warning before we start the activity? Yes, this can be somewhat traumatic, if nothing less than somewhat uncomfortable, any range in there. And these are very important. And we do read these activities at the beginning, read a statement at the beginning, which Jennifer did read at the beginning of this. And that seems to have been enough for our students. I guess, depending on our who we work with, we might want to state something a little bit more clearly on that, though. Jennifer, do you have anything to add to that one?
I don't. And again, you have to remember that this was taught in the midst of the semester in our courses. So most of the terminology and all the awareness was brought forth as we developed with the students in the course. So attributing to that, someone said, you can't say this is a good tool if plain language isn't used. We are all health professionals and we're questioning, how do you expect students to really get it? That ties into what we talked about earlier today in the slides and talking about terminology, understanding that we go through the wordings as we develop through the course. So by the time we implement this activity, most students are acclimated with the wordings. Today, we didn't have the time to, of course, go through as we would if it wasn't a course, but by the time we implement this, most of the students are acclimated.
I'm trying to read through a little bit more. We can, George, I think you're on the call. Can you help? We did not provide these questions, but we could, can I share them with you by email and then get them out to our group, or maybe add them onto our handouts for the session?
Yeah, I believe you can with IHA. They should, if you gave them to them, be able to get them out to everybody.
Okay. I will follow up with that, and hopefully we can add it to our handouts for the session on the webpage for the conference shortly. Why do we read the questions instead of having the participants? Why do we have them listen instead of read them? It's just that we've done this when we're either live in person or on a Zoom this way. So we can, we felt it was kind of control the pace of it. And we can also incorporate this into our 100% online asynchronous sessions by offering these questions in a written form. Our students are typical college age, ranging from about 18. And we do have non-traditional students in our majors, so up into their 50s. So I'm continuing to read these. Try to adding religious expression. That's an important one. We realize that many things that have been much more visible and apparent to us in the news and in our lives in the last couple of years probably could change some of the things we add to these questions. So thanks for that one as well.
Someone asked in the question, how did you choose the 40 statements you used? Were there other statements that could have been used? So we developed these statements by connecting them to the social determinants of health. We've looked at each determinant and sort of pulled from that to get these questions. There are additional questions that you can add to this. For instance, we added healthcare questions and many other factors relating to the determinants of health can be used. But primarily we got those by looking at those various areas.
And we also looked at other privilege walks and privilege activities, looking at the questions that were included in other activities and kind of incorporated them all. There were probably maybe 8 to 10 different sets of questions that we looked at to make up these. Gary just asked if we published the study or the survey results. We are just getting underway with this because of the nature of our courses over the past year. They have been mostly 100% online. We started incorporating some synchronous online activity, but overall, the students that we have access to right for the past year have been remote. So we've shared percentages, but the overall number of students we've interacted with was smaller than we hoped. But we definitely want to continue working on this and think that it has a place. And quantitative and qualitative models are definitely a part of what needs to be included. And we hope to continue sharing this. Jennifer, do you want to add a little on the deck of cards activity? And I think we're ending at 12, at the 45, right? In about a minute?
Correct.
Okay.
Sure. So the deck of cards activity, how we implemented it was, again, we had a deck of cards and each student was given a card. Once they were given the card, they were to place the card on their head. So we took out jokers and aces, anything of that nature. If the student was given a 3 or if they were given a 2, other people in the room had to treat them how you would think a 2 would be treated. Or if someone had a king, others would have to treat them how you think a king would be treated. We let this activity go on for roughly 10 minutes or so. And what we found was that the 3s began to group together and the kings began to group together, the queens, and so on. And what we did was we started to say how individuals were treated and how it related to the environment. So we connected the social determinants of health with that. And then we did an evaluation piece that was open discussion. And with this, again, students stated that their eyes were open. They began to see how others are seen in and around their environment.
Well, I think we're at the end of my time, end of our time. I believe that I keep clicking the wrong slides here. I apologize for that. We will be able to share additional answers and responses and questions on the session. We'll work with the IHA staff to make sure that happens. We really appreciate everyone who's joined us today and all of the feedback and comments. And hope that this has added to your knowledge of ways to use a privilege activity, also on how to incorporate social determinants of health and health literacy, and that we can continue making a difference in whoever's lives we interact with. So thanks for joining us.
Yes, thank you.